Hello, today we are going to talk about Hallux Valgus deformity. So what is it exactly? By deformity of the big toe, we mean the deviation of the big toe outward and the appearance of the so-called bunion. The main causes of this bunion are genetics as well as wearing narrow shoes and high-heeled shoes. Hallux valgus deformity of the big toe is classified into 3 degrees: mild, moderate and severe. With a mild degree of hallux valgus deformity, the main symptoms are usually pain in the area of the first metatarsophalangeal joint, a slight deviation of the big toe, and the appearance of a small, slightly protruding bump. There may also be minor calluses. With a moderate degree, as a rule, the angle of deviation of the big toe increases. The so-called bone or bump, as it is commonly called, also becomes larger. There is increased redness, calluses appear, and pain occurs not only when wearing shoes, but also as nighttime pain. And with a significant degree, as a rule, the angle of deviation of the big toe is greater than 40 degrees. There is the appearance of a large protruding bump, calluses, as well as deformation of the second, third and fourth toes. Quite often, hallux valgus is complicated by the appearance of a protruding bone in the area of the fifth metatarsophalangeal joint. And this deformity is called Taylor's deformity. Hallux valgus can also be complicated by the development of Morton's neuroma, in which sharp, acute pain occurs either between the second and third metatarsal bones or between the third and fourth metatarsal bones. Treatment of hallux valgus is generally of 2 types, conservative and surgical. Conservative treatment is usually effective only in the early stages of hallux valgus. After that, unfortunately, it will no longer be effective. Conservative treatment includes wearing shoes with a wide toe box, as well as the use of anti-inflammatory agents, foot exercises, and also wearing orthopedic insoles. As a rule, orthopedic insoles should be custom-made. After conservative treatment, if it did not help, or if patients have already come in with an advanced stage of first toe deformity, then the patient will require surgical treatment. There are quite a few surgical techniques for treating hallux valgus deformity, but as a rule, they are all aimed at removing this bony exostosis, this protruding bone, as well as performing several osteotomies on the bones in order to return the big toe to its original position. Overall, the entire surgical process consists of administering anesthesia. Anesthesia can be either regional or spinal. Next comes the surgical correction. Most often, this involves excising the bony exostosis, then performing corrective osteotomies on the bones and applying sutures. There are also techniques that use metal fixation. The rehabilitation period after correction of hallux valgus usually ranges from 4 to 6 or even 8 weeks. To prevent the development of hallux valgus, I recommend you take a look at your mother's and grandmother's feet, since most often this deformity is genetic. Also, I recommend avoiding wearing high-heeled shoes as well as shoes with a narrow toe box. Make sure to perform your foot exercises daily. Try walking barefoot more often on surfaces like pebbles or sand, and also wear orthopedic insoles.